Good morning. My name is Professor Mark Ashton. I'm a specialist plastic surgeon based here in Melbourne. One of the things that people often ask us is, why did you do plastic surgery and why do you have to go to all these conferences all the time? Surely you've learned enough already. Well, I suppose one of the reasons I got into plastic surgery in the first place was because I liked the combination of surgery and artistry. And one of the nice things about plastic surgery is that people all around the world are continuing to redevelop and reassess and refine what we do. A typical example of that would be, say, breast reduction surgery, where the surgery now involves significantly smaller scars, much faster recovery, and a much better long-term result than what we saw even just 5 or 10 years ago. And those techniques were discovered by a combination of people working either here in Australia, overseas in America or Canada, or in Europe. And the only way you can really keep up to speed and provide you and my patients with the very latest and very best in patient care is to be right up at the forefront of what's happening around the world. For that reason, I travel overseas every year to both the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgery meetings, which are held in America each year. I run a course here in Melbourne in conjunction with Brian Mendelsohn, Tim Papadopoulos, Mark Magnuson and a number of other plastic surgeons from Australia, aiming at refining and reassessing our results in facial anatomy and facelifting surgery. I also am heavily involved in the Australian Society of Plastic Surgeons and I'm on their executive council, and involved therefore in running our annual conference which is this year being held up in the Gold Coast next month. Also heavily involved with the Aesthetic Society and the Non-Surgical Symposium, which looks at teaching people who are involved in fillers and injectables on how to safely perform their craft reliably and predictably. This is usually a combination of a didactic 3-day course and also a one-on-one 1-day anatomical workshop. A lot of this information is posted on our website, but you'll see I'm also a reviewer for the 2 main journals in the world in plastic surgery. That is the American Journal of Plastic and Reconstructive Surgery and the British Journal of Plastic Surgery. And just this month we're launching our Australian journal called the Australasian Journal of Plastic Surgery, which together with Mark Lee, I'm editor-in-chief. If you have any questions regarding ongoing education or some of the insights which we've been able to glean from the world literature in the last 12 months, please don't hesitate to give our rooms a call. Alternatively, look on our website, or even better still, come and have a chat. I'd love to talk.